So here's what we need to know about the Metro Manila community quarantine from March 15 to April 14, 2020.
COVID-19 is spreading all throughout the country.
Mabuhay Filipinas.
Kind of pandemic in terms of investors' minds.
And will run for a month.
Including the Philippines.
Diagnostic test, that is PCR based.
And to those who insist on still going in.
Hindi po ganun yan. May kailangan pa rin yan.
May big time.
Mabuhay Filipinas. Magandang araw everybody. We are just few hours before the lockdown of Manila.
Magandang hapon po sa inyong lahat. I hope that all of you are doing well, and this has been a very, very difficult time. We are experiencing a pandemic of the coronavirus.
Mahirap pa talaga.
Opo, I mean, our lives are affected, our schedules are affected, our plans, we have to postpone our travels. Even our work is affected, we are losing money, we are losing income. Pero ganun pa man po, ito ay sacrifice na kailangan po namin gawin. Para
And this
rin
time
po sa ating kalusugan.
This time to follow what the government say. Walang right now politics, walang I like Duterte or I don't like Duterte. Experiencing from Italy, following the example of Italy, just follow what the president is saying.
Kasi po anong nangyari sa Italy, this is what we can learn from from what Italy is going through right now, is that they just considered the coronavirus as a bad flu. They didn't take it seriously. They still went out even if they were advised, to stay at home. People ignored it.
In all over Europe, even until now, all over Europe, people didn't take really seriously this.
Until people started dying, until their grandmothers started dying, until their mothers started dying. And by that time, the health system is collapsing because there's so many people in the hospitals. Although Italy is one of the best in terms of healthcare system. It's free for them.
Free talaga.
Hospitalization, checkups. Free po sa Italy.
If you have a problem right now, even right now, if you have a problem, you feel sick, you go to the hospital, they will assist you for free. So walang pera, you don't need to spend money, and they can assist you. But just even if like this, the hospital are really now collapsed.
Saturated.
And people, the hospital cannot even help everybody anymore. So there is, they need to even to choose
to
who
that
help.
Point. Why? Because this virus spreads so fast. And asymptomatic po ang mga tao. Minsan there are cases na hindi po nagma-manifest ng symptoms. Kaya hindi po na-detect kaagad. Yun ang problema dito eh. Kung ma-detect man, huli na. Plus, we don't have the vaccine for this virus. It's a novel virus bago pa po siya, okay?
And in fact,
at saka testing kit. Wala tayong, ang Pilipinas, we don't have enough testing kit.
And also, just taking an example, Spain, France, and Germany, just in the previous night, the cases this morning are increasing really drastically. There are more than 1,000 cases found in Spain, I think, and many more also in France and Germany. It's really getting crazy. So just follow and let's follow the bulletin point that the government say, and let's try to understand why we need to follow this, because the situation in the Philippines, it's really mahirap talaga if this virus will spread really a lot.
Kaya po, iwasan na natin pong lumala ang sitwasyon dito sa Pilipinas. Let's cooperate and let's understand the guidelines. The government will still issue further guidelines about the lockdown, but let's go one by one the points and the directives issued by the government a few nights ago during his speech, his televised speech. We ourselves watch it. We've been monitoring the news all over the world, and information po is very vital para hindi po tayo magkaroon ng panic or takot. So stay at home, and we hope this this information and this breakdown in information would clarify some things about
Yes.
the lockdown.
Because let's say already, I mean, even this morning we wake up we wake up and we read the first news that one guy was found,
patient.
one patient, we don't know male or female, but one patient was found in Quezon City with coronavirus. This person ran away from the hospital and went to Salute. This is really wrong. This is really totally crazy.
Nahanap naman
I
po
mean,
siya ng mga pulis. Tinrack down naman po siya ng mga pulis sa St. Los. Pinabalik po uli siya.
you cannot do this. I mean, you really don't you don't
Diyos ko po, maawa po tayo sa ibang tao.
even go to the grocery. We really saw, even by ourselves we saw ang daming tao sa grocery. There is really no need. Don't run there.
Yung mga cashier, si Mirko himself is doing the bagging.
Yes.
Because wala na pong bagger.
Because we was really without food, we really had to go. But go only if you need. I mean, don't go and buy thousand of food. There is no need, because the food will keep coming in the Philippines.
Hindi naman po siya kasama sa lockdown.
Yes. It's not.
So these are things that we need to clarify. So the more that we understand the lockdown or the community quarantine actually of Metro Manila, and the less panic.
Yes.
And
don't try to run away from Manila. I mean, if you are in Manila, don't try to go out of Manila right now, because we saw this morning also that the Pier of Batangas is totally full of people. People are trying to get airplane going to the provinces. This is really wrong.
There are exemptions. There are so many things that that's beyond our control. Now we cannot say what should be done, or it's not our decision.
Just following what is happening in Italy. I mean, if we base what is happening in Italy, when the lockdown in Milan was called, the same night, ang daming tao tried to run on South Italy, and
kumalat po yung virus.
and they spread the virus all over the Italy. That's crazy. This is really not right to do, because also you imagine your families. If you have the coronavirus, you don't know. You are in Manila. You go to any place in all over the Philippines, and you will spread.
You can just imagine nga po, our country is not that equipped. We don't have thermal scanning everywhere. I mean, in the
Walang
ports,
hospital somewhere.
And plus, ngayon they're talking about if they will put a hospital just for the coronavirus patients. Saan po natin ilalagay yun? Wag na po natin pahantungin sa gayon. Tayo po ay magkaroon ng disiplina sa ating sarili. Okay? Stay at home. Kung kayo po ay may sakit, kahit may just stay at home. Wag na po tayong lumabas. Kami, we've gone out, we've even doing the grocery. We still see people coughing without covering their mouth.
Coughing or touching.
Coughing everywhere, and they're just touching people, like even overtake sa linya, sa mall.
Isang lola was coming to me, touching me. That's really not good. It's really not good.
Dahil lalo na nga po ngayon na meron na nga pong directive ang ating mayor na bawal ang beso-beso, bawal ang handshake. So here's what we need to know about the Metro Manila community quarantine from March 15 to April 14, 2020. On March 12, 2014, President Rodrigo Duterte has announced his decision to raise the Code Alert system for the coronavirus disease in the Philippines to Code Red Sublevel 2. What is Code Red Sublevel 2? Health Secretary Francisco Duque explained that this highest alert level is raised when there is sustained community transmission beyond the capacity of the government to trace cases of the coronavirus. According to him, this can be declared if there is evidence of transmission that they can no longer link and that they can no longer identify the source of infection. So, is it a lockdown or community quarantine for Metro Manila? According to Chief Presidential Legal Counsel and Presidential Spokesperson Salvador Panelo, community quarantine is imposed in the entire Metro Manila from March 15 to April 14, 2020. What is the difference of lockdown and community quarantine? The term lockdown generally means a state of isolation or restricted access instituted as a security measure, which was implemented in Wuhan, China, and Italy, where a sudden spike in the number of coronavirus cases and deaths were recorded. Down stores and restaurants are closed, and government advises citizens to stay at home, and all flights are cancelled. Community quarantine refers to restricting movements in an area that might have been exposed to infection without necessarily saying that the residents there are sick. Individuals can freely go outside their homes, go to their jobs, and public transport and other basic services are still operational. Travel and movement is confined only within a designated area to avoid spreading the virus to other cities or provinces. What is the basis of the Metro Manila community quarantine? President Duterte's declaration of the Metro-wide community quarantine is based on the recommendation of the Interagency Task Force on the Emerging Infectious Diseases composed of key cabinet officials and the Department of Health. Under Section 6, Article 3 of the Constitution, the government has the power to limit the right of people to travel if it is in the interest of national security, public safety, or public health, as may be provided by law. Who are affected by the community quarantine? Over 12 million people in Metro Manila will be affected by this. It covers all 16 cities and one municipality of Metro Manila, namely Manila, Quezon City, Caloocan, Las Piñas, Makati, Malabon, Mandaluyong, Marikina, Muntinlupa, Navotas, Parañaque, Pasay, Pasig, San Juan, Taguig, Valenzuela, and the municipality of Pateros. What entails the Metro-wide community quarantine? The approved imposition of stringent social distancing measures in the National Capital Region or Metro Manila for 13 days include the following salient directives. First, suspension of classes in all levels in Metro Manila is extended until April 12, with students remaining in their homes for the said duration. Second, mass gatherings, defined as events where the number of people attending could strain the planning and response resources of the community hosting the event, shall be prohibited during the aforesaid period. Mass public transport, such as the light rail transits, the metro rail transits, and the Philippine National Railway shall continue in operation following guidelines by the Department of Transportation intended to ensure social distancing. Land, domestic air, and domestic sea travel to and from Metro Manila shall be suspended beginning March 15 until April 14. Flexible work arrangements shall likewise be encouraged in the private sector, following guidelines from the Department of Labor and Employment and the Department of Trade and Industry designed to safeguard the welfare of the workers. All manufacturing, retail, and service establishments shall remain in operation during the same period provided that strict social distancing measures are observed. Entry travel restrictions shall be imposed upon those traveling from countries with localized COVID-19 transmissions, except for Filipino citizens, including their foreign spouse and children, if any, holders of permanent resident visa, and holders of diplomatic visas issued by the Philippine government. Interior Secretary Eduardo Año said those who have daily jobs inside the Metro Manila area but live in nearby provinces will be exempted from the travel order as long as they present a work identification card or proof of employment. He also said the transport of food and supplies will be allowed in Metro Manila during the quarantine period. Police and military checkpoints will be put in place to check the public's compliance with the recommendations of the IATF-EID.